economically. Now, friends, if you're having a child with a sickle in your home, one, you will be economically drained because every time you are at the doorsteps of the hospital, every time. But also, two, you will not be actively participating economically, engaging your productive time because you will be unattended. So prevention is better than cure. This is our attempt to ensure that we have these machines to save the people of Lamu. We want you to put politics aside, religion aside, clan aside. I've been on radio station, I made it clear. There are three things that will never compromise your status. Number one, anger. When you are hungry, it will not challenge you whether you are DP, UPC, or NRM. The anger will demand that I need food. Number two, when you are sick, we shall not first verify whether it's an NRM nurse or an NRM doctor treating you or a UPC nurse or doctor. You will be at the mercy of the doctors. Number three, when death calls, it's not only one political party dying, one religion dying. Everybody is what? Dying. So we must be sober when we are taking the social community responsibilities like this. We must be sober, we must be independent, and we must act, and we should act now. I thank you so much. And with this, allow me to take this opportunity to invite the Executive Director of CAPSI, who will make his address. Thank you.
Orange. Okay. Well, it's good afternoon and welcome to this address or to this presser. We are so much privileged to have you here this afternoon, and thank you for honoring our invite. The Uhuru Sickle Cell Run is here for us, for the people in this region, given the fact that this region has the highest prevalence of sickle cell in this country. Like the chairman organizing committee has made mention that Aleptong has the highest prevalence of sickle cell in this country. And Aleptong district happens to be in the northern part of the country, that is Lango sub-region. Then you go to the eastern part of the country with close to 17%. Then you head up to the central part of the country with 10%. Then also you head to the western part of the country with 4.1%. There are very many contributing factors that is probably leading to some of this. One of them is lack of awareness and sensitization. And that also falls into one of our core niche as an organization to raise more awareness and sensitization about sickle cell. There are still other challenges, but however, I would like to thank the Ministry of Health that the moment the newborn screening was introduced, this is helping a lot in early diagnosis and also management of sickle cell, given the fact that sickle cell is a chronic disease. That means that you will lose lots of money in trying to manage sickle cell. We currently have hydroxyurea, and hydroxyurea is more or less for managing certain pains, the episodes of infections, and so on and so forth. Bone marrow transplant, it is so expensive, like the chairman hinted on. Somebody deep down in Omoro, in Alolololo, might not be in position to afford this, to afford bone marrow transplant. 120 million to close to 500 million. So somebody deep down now in our villages there might not easily afford. And the best way to help us combat this is prevention. Before you get married, before you get sexually active, we advise that students or whosoever is intending to get married should know their sickle cell status. Why the HB electrophoresis machine now? The HB electrophoresis machine will help Lira and Aleptong districts in doing confirmatory tests, because currently all the tests which are done from this region is sent to the Central Public Health Laboratory. And once it is sent, that means sometimes it takes some good numbers of weeks or months without the results coming back. But once we have this available, that means once you have been tested on any other RRDTs and you have proven to be having some traits, that means Lira Regional Referral Hospital will be in position to do a confirmatory test there and then without referring you to Kampala. So the turnaround time will also, it is more or less like about 15 minutes. So that means that time will also be saved. You're getting your results in a timely manner. Our organization, we mainly deal with about 434 core areas. One of them is awareness and sensitization, patient care and management. We do talk to a number of caregivers, people who, like mothers and fathers of these warriors. We call them warriors because of the episodes of pain that they do go through. I'm sure Frank, right behind there, has ever tried tying his index finger with a rubber band. If you tied it for so long, it would turn dark, right? With a lot of pain. So that is just an iceberg, or just a very minute portion of the pain that these warriors do go through. Incumbent to that, we have also been doing massive testing around institutions. We have met some stakeholders to try and let them know that, one, sickle cell is not a death sentence, and sickle cell is not caused through witchcraft. We have been to villages, a number of villages, where people are associating sickle cell to witchcraft. So we have been trying to demystify this myth in this region. And the fight against sickle cell does not, it has to begin with you, with I, so that we carry on these messages to the last person down there. If we only had the same approach that His Excellency, the President of the Republic of Uganda, has been using to combat HIV/AIDS, that 95-95 casket of elimination of HIV, we would have been far by now in trying to combat sickle cell. We are very much appreciative of a number of partners and donors that have come up on board to support us. The President's office has been with us right from day one in trying to galvanize our efforts towards combating sickle cell disease across the country. Nicosam has been there, Stanbic Bank, KCB, and all other partners, they have been there for us. And we are still hopeful that, one, more partners are coming up on board. And we are doing this for Lango. There was a request already in Gulu. There is another request in Fort Portal, in Tororo, that next year's run should be held in all those districts on the same day. Yet this is only the first time that we are organizing such a run. So that calls to you that we need a concerted efforts, or we need to augment our different efforts towards combating sickle cell. Come that day, on Saturday, the 5th of October. We shall be having lots of visitors around. And this is also an opportunity for a number of our hospitality places around Lira to host them. We have quite a number of people who are coming from Kampala. And our very own Julius Achon is coming to sprint for the first time. Some of us, we have never seen him run around, but we shall be seeing him take on some kilometer, which comrade here will come and tell us is very much ready. Moses Kipsiro, we have never seen him run physically like this. He will be here present. So that is also an opportunity for our people to come and see some of these people run. Besides raising money for awareness, there will be lots of networking events. Different companies are coming to showcase what they have been doing. Different pharmaceutical companies are there coming to show you different products which they are currently using to manage sickle cell patients. Some will be merrymaking, you know. So networking, nyama choma, talk about it. It will all be there. Thank you.
Let me ask you before we shift. One might wonder, with all these challenges that we have, the burden that is on national government, how is the land going to affect?
Fine. One, I hinted about sickle cell. This region having the highest prevalence of sickle cell. Awareness is very key. On that day, we shall have lots of messages for awareness. We also have parents whose children have undergone bone marrow transplant. They will be telling us their experience. We also have couples whom, after finding out, like today is a Wednesday, they have they had their introduction on Saturday. The moment they discovered that one, they were all carriers. They had to sit down and agree on certain things. So we shall be having people there to talk to us, people who have undergone all these processes, the pain, the survival. Catherine Field is an indigenous organization. Catherine was a very nice lady who had the heart of community, philanthropy, supporting children. Philip is my late nephew who passed on after doing a bone marrow transplant. So this is not any other white man's name somewhere or saying that this and that. No, it is locally our name here. In other words, in the local name, somebody would say, Catherine Kere Pilipo. That's it. So apart from that, we shall be having massive testing. People should come and test free of charge, totally free of charge. There will be counseling sessions on that day for people who want to test to know their sickle cell status.
How much is this machine?
Each machine is 15 million shillings.
And what is your target?
Our target is to at least even raise as much as getting 3 machines. Because once you set some target, you also need to project on, and now, like for example, our target is about 3, but we have been mentioning 2. But should we hit the target and surpass that, we have no objection to have the 3rd machine available. And we shall work closely with the Ministry of Health to know where these machines will be placed. This machine has already been validated by the Ministry of Health. We are not just going to maybe procure it and say, Mahekuri Komu. No. We are already, we are in close collaboration with the Central Public Health Laboratory. And this machine is validated, the Gazelle HB electrophoresis by Nicosam Healthcare, Uganda. So we are not doing anything behind the Ministry of Health.
What risk do you have with our community?
Shouldn't we achieve this? Very many people will continue going into marriages without knowing their sickle cell status. We shall have high number of sicklers around, and that means it will even cause poverty into people's homes. Because once you have a sickle cell patient home, you can't save money. Almost every week you're running to the hospital. Can't afford to save any money.
Thank you. We're going to have our main promoter have a slot of about we are giving at least 3 to 5 to each. Then we get to our